You are connected, and you are listening to Specifically for Seniors, the podcast for those in the Remember When generation. Today's podcast is available everywhere you listen to podcasts and with video at Specifically for Seniors YouTube channel. Now, here's your host, Dr. Larry Barsh.
Today's podcast is a difficult one for those who are our age, but it is an important one. The subject is one we will all probably experience for our parents or ourselves as we age. My guest today is Howard Gleckman. Howard is Senior Fellow at the Urban Institute, where he's affiliated with the Tax Policy Center and the Retirement Policy Program. He's the author of a new book, Caring for Our Parents, Inspiring Stories of Families Seeking New Solutions to America's Most Urgent Healthcare Crisis. Before joining the Urban Institute, Howard was correspondent in the Washington Bureau of Business Week. He's written for the Washington Post, Forbes, and USA Today. Welcome to Specifically for Seniors, Howard.
Good to be with you, Larry.
Thanks for being here. In your book, Caring for Our Parents, you start with your and your wife's story about caring for your parents. Can you introduce the listeners to the book and what your experiences were?
Sure. I was a journalist, as you said in the introduction. My wife was a lawyer. We both were sort of in the business of asking questions and kind of knowing what we were doing. And one evening, I'm sitting at home reading a book, listening to music, and my wife is out at some meeting, and the phone rings, and it's my father-in-law. He's calling from a hospital in Florida to tell me that my mother-in-law has had a stroke, and he has no idea what to do. And that phone call changed my life. The first thing I had to do, of course, was figure out a way to tell my wife what had happened. We got on a plane the next day, got to Florida, discovered that my mother-in-law had a very severe stroke that was on life support, and my father-in-law had advanced cancer, which they hadn't told anybody in the family about. We had to first make a decision to take my mother-in-law off of life support, and then we had to figure out how we were going to care for my father-in-law. We all made a decision together that the best thing for him to do was to move to the Washington area, Maryland, where my wife and I lived, so we could take care of him for the last days of his life. And while we were doing that, we had just sort of got him settled. I got another phone call from Florida, from my parents, telling me that my father was in the hospital with congestive heart failure. And we then had to figure out a way to care for him for what turned out to be about 18 months of his life. My mom and an aide were able to care for him, so he stayed at home. And I learned a couple of things. The first thing I learned is how incredibly difficult it is to be a caregiver. And the other thing I learned was what a mess our long-term care system is. It's not connected in any way really with our healthcare system. Doctors can't tell you anything about long-term care or the supportive services you need. The financing is completely different. Health insurance doesn't pay for any of this. Medicare doesn't pay for any of this. Mm-hmm. So I eventually changed careers, wrote this book that you mentioned, and went to work for the Urban Institute, where I do research in the world in part of the world of long-term care.
Let's start by defining what long-term care means, what it is.
So let me start by saying what it isn't. It's not medical care. It is the supports, the social and personal supports that somebody needs. Someone with chronic disease needs to live the best life they can. That may be a home health aide, it may be an adult day program, it may just be somebody helping you balance your checkbook, or going to the grocery store. It's that whole range of social supports that people need as they become frail in old age. And about 70% of us are going to need a significant level of that care before we die. There are some of us who will get hit by the proverbial bus. Some of us, like my mother-in-law, will have a stroke and die. But for the most part, we will live long, healthy, relatively active lives until we become too frail and something will happen and we'll need help.
And in this country, the long-term care, quote unquote, system is failing us.
Completely. Both the financing system and the delivery system. We can talk about both of them because they're different with different problems, but both of them have failed. So the financing system, such as it is, you essentially pay for it yourself until you go broke, and then you go on to Medicaid. And when you go on Medicaid, you're guaranteed a room in a nursing home. You may have to share the room with a complete stranger, and it may be a terrible nursing home, but you're guaranteed a room in a nursing home. And in every state, you're guaranteed some what they call home and community-based services, which is some home care. But that varies a lot from state to state. It's all a welfare-based, income-based system. The United States and England are the only developed countries in the world that don't have a social insurance program for long-term care. Every other program, every other country, whether it's Singapore or Israel or France or Germany, has a well-developed social insurance model. Essentially what happens is you pay a payroll tax while you're working, and then when you need this care, you get insurance that pays for at least a fraction of the care you need. In the United States, we don't do that. You only get government-based care, Medicaid, when you're poor enough and sick enough. And when I say poor, I mean really poor. You have to have assets of less than $2,000, and you have to have income of less than $1,000 a month. So essentially, you've got to be dead broke before you're eligible for this program.
So it's even less than Social Security provides.
Yeah, for a lot of people.
What are other countries doing? Countries like Japan, the Netherlands?
So they're all a little different, but they all have something in common. So as I mentioned, basically the way they work is you pay a payroll tax, like we do for Social Security and Medicare. You pay an additional payroll tax, and in some countries it's 1% of wages. In some countries it may be as much as 8 or 9%. In Netherlands it's 10% of wages. And in return for that, when you need a high level of care, you need support doing bathing or eating or getting to the bathroom, this program automatically kicks in and you get a benefit. In some countries, it's a cash benefit, so it works a little like Social Security. You just get cash and you can spend it on whatever you want. If you need a wheelchair ramp, you can buy that. If you need an aide, you can hire an aide. If you want to hire your next door neighbor or your niece, you can do that. In other states, it's more like private long-term care insurance in the United States. It's a reimbursement model. You pay for approved care and you get reimbursed for that. So in some places it's cash benefit. In some cases it's a service benefit. You don't ever see the cash. The government just pays for the service, whether it's in a nursing home or whether it's a home care program. In some countries like Germany, you get a choice. You can either get cash or you can get services. In Japan, it's only a service benefit. There's no cash. In France, it's only cash. There's no services. So it varies a lot, but basically the model is you pay payroll taxes while you're working and you get this benefit when you need it.
Mm-hmm. There was just an article in the Boston Globe about the Netherlands system. Is that different?
So the Netherlands system is very different. And let me, again, break it up into two pieces. I'll talk about the delivery system and then the financing system. The finance system is social insurance. It was until 2015 an incredibly generous program. And it was so generous that the system was going broke. The country was going broke. And not so much because of older adults who needed the care, but younger people with disabilities who were getting years and years and years of very expensive institutional care. These are people with developmental disabilities like autism or Down syndrome or something like that. And it was turning out to be incredibly expensive. So in 2015, the Netherlands revised the financing system. They broke it up into pieces. Now people with disabilities get one kind of benefit. Older adults with a high level of need get a different benefit. Some of the benefits, instead of being provided by the federal government, are provided by their equivalent of state governments. and the amount of aid of support that you get has been reduced a little bit. But it's still a very generous benefit, and you get it by paying about 10% of wages up to about $35,000 in payroll tax. When you need the care as an older adult, the system pays for about 90% of the care, and you pay for about 10%. Mm-hmm. So that's the financing system. That very generous financing system has developed a fascinating new delivery system. So in the United States, let's take somebody with dementia, obviously a very common need among older adults. What do? We lock you up in a memory unit of an assisted living facility or a nursing home. You have very little ability to move around. There's not much for you to do. It's not a great system. In the Netherlands, what they've done is they've created almost these little villages so that people have maximum flexibility. They can go into little stores. They can go into restaurants. As that Globe article said, they can't go to art museums necessarily, but the art museums bring art to them. A whole range of programs. They can't leave this community, but within the community, they're free to walk around. And what they've discovered is that people given that autonomy are much healthier than they are in the United States. In the United States, we worry so much about things going wrong, we take away people's freedom. And all of us would like a certain amount of autonomy. You know, in the United States, they have this model called greenhouses, which are much more flexible kinds of small nursing homes. And one of the big differences between a greenhouse and a traditional nursing home is a traditional nursing home, somebody comes to your room at 7:30 in the morning and they say, Larry, it's time for your bath, whether you want a bath or not. You may want to sleep in that morning, just like some mornings I want to sleep in. Mm-hmm. Can't do it in a traditional nursing home because that aide has got 10 people she has to bathe between 7:30 and 8:30, and you're going to get up and you're going to get your bath whether you like it or not. In the Dutch system and in greenhouses in the United States, that's not how it works. You say to the aide, you know, tomorrow morning I want to sleep in, you know, give me my bath at 10 o'clock. I don't want it at 8 o'clock. And they say, okay, not a problem. So that very regimented system that we have in the United States is very different over there. In the United States, we're terrified that people are going to fall. In the Netherlands, they say, we're going to give you some autonomy. You fall, you fall. It's up, it's up to you. You make a decision. You want to take a risk. And just like me, I take a risk. I go skiing. I fall. I took my chances. I fell. So there's a recognition that even if you're old, and even if you may have some cognitive impairment, you have the right to make decisions for yourself. And that's a big cultural difference between what they do in the Netherlands and what they do mostly in the United States.
Is there more societal responsibility in the Netherlands, for example, than there is here?
Yeah, Larry, there is almost everywhere in the world. There is in all of Europe, particularly in Northern Europe, but really in all of Europe, in parts of Asia, certainly in Middle Eastern countries like Israel, there is this sense of social solidarity that we all are in it to help one another. In the United States, we think of ourselves as kind of the John Wayne figure. I'm out there by myself riding my horse in the Wild West, and I'm not going to take care of anybody, and I don't have any expectation that anybody's going to take care of me. And that's unfortunate. And again, we have exceptions. We have senior villages. We have other models in the United States where people do care for one another. But for the most part, that sense of social solidarity just isn't here.
And that's not getting any better.
No, not at all. Not at all. I do a lot of work looking at ways that communities can help support one another. And sometimes they're faith communities, sometimes they're churches or synagogues or mosques where people can get together and help one another. And in the places that do it, it actually works quite well. There are these senior villages in the area that I am in the Washington, D.C. area. There are probably 40 or 50 of them. And they're community-based, not-for-profit organizations where people help one another. So if I need a ride, I notify a central office that I need a ride to the doctor at 10 o'clock tomorrow morning. You may have time, and you let the central office know you're available to drive me, and that's what you do. You give me a ride. If you need companionship, you just need somebody to come visit one afternoon, I put down that I can do that. I come over to your house and we play cards and shoot the breeze for an hour. So there are these kinds of models that are developing around the country, but they're few and far between.
Is Congress doing anything?
So
okay, sorry about that.
Yeah, what's the next question? So when COVID happened, and you know what COVID was, 700,000 older adults died from COVID. 200,000 residents and staff of nursing homes died from COVID. I thought that Congress finally would take some steps to fundamentally change the long-term care system. I thought that crisis was such a catastrophe and it was so big and it got so much attention that Congress would finally act. Well, in 2020, Congress did pass one bill that expanded home and community-based services under Medicaid by about $12 billion for a couple of years. So that provided a little more benefit. Mostly what it did was in most states it was used to pay the aides a little more money. President Biden proposed $400 billion in additional home and community-based services under Medicaid over the next 10 years. There are also proposals to improve nursing home care. There are also family leave programs so that families could take time off and care for older adults or for other family members. None of that passed. All of those provisions were dumped from this bill that just passed a couple of weeks ago. So essentially, other than that one temporary increase in Medicaid funding, Congress responded to this extraordinary, historic crisis for older adults that was COVID by doing nothing.
So the bottom line in this country is we've got to help our parents to take care of themselves, and we've got to plan for our own aging.
Yeah, I mean, this may somewhere down the road change, but right now, my message to people essentially is you're on your own, and you got to plan for it. I mean, long-term care is incredibly expensive. A nursing home costs $100,000 and up, depending on where you are. Home care, an aide now costs easily $30 an hour. There's such a shortage of aides that they are now demanding more pay, which they want to get. And by the way, when you pay an agency $30 an hour for a home care aide, the aide's only getting about half that. The aide's only getting about $15 an hour.
Less.
The agency's getting the rest.
Less.
So, the aides are not exactly rolling in dough, but they are getting a little more money than they used to. $30 an hour, think about it, if you need 8 hours of help a day, that's over $200 an hour, $200 a day. It's a lot of money, and most people don't have it. So what do? You need to plan for it early. When you're in your 30s and 40s, you need to start saving, and you can't be in denial. You got to understand. Like I said, you got a 70% chance of needing this help, so you better do something. You either save for it, or maybe you have home equity that you can use. Sell your house or get a reverse mortgage or something like that. Or you can buy private long-term care insurance. Not many people do that these days, but you can do that. Otherwise, you just spend what you got, and when you're broke, you go on to Medicaid.
You said not many people get long-term care insurance today. Is that because of cost or just?
Yeah, there are a number of sort of subsidiary reasons. People have trouble understanding it. They don't have foresight. Americans don't have a lot of foresight. They can't think about what it's going to be like when they're 85 and need help. Mm-hmm. But the main reason is it's just too expensive. A decent policy now costs $3,000 and up a year, and people don't have that money. You think about it, if you're in your 40s, you're probably just now starting to think about putting a kid through college. You've got a home mortgage, you've got car payments, you've got health insurance to buy, maybe you've got your own student loans you're still paying off. You've got this long list of stuff you need to do. Somewhere at the end of that list is long-term care for when I'm 80. And people just don't get to it. They don't do it. I used to, before COVID, I used to talk to consumer groups all the time, and this would come up. People would say, "Well, I don't need to buy long-term care insurance. I can just save for it." And I say to them, "You're right. You could. You won't, but you could." And that's the problem. We don't save. Private long-term care insurance, in theory, is a great idea, but in practice, it's just become too expensive. Insurance companies don't want to sell it because it's so risky for them. 15 years ago, there were 100 companies that were selling long-term care insurance. Now there's about a dozen. And people don't want to buy it. Last year, 50,000 people in the entire United States bought standalone long-term care insurance.
Really?
Yeah. More people bought what they call combo or hybrid insurance, where they combine it with an annuity or whole life insurance. About a few 100,000 people bought those policies. But to buy an annuity, most people can't afford those. Those are really for upper income, wealthy people.
Mm-hmm. Can we talk about the advantages and disadvantages of aging at home as opposed to a senior living facility?
Sure. So often advocates will say there's no need for nursing homes. Burn them all down, turn them into parking lots. We never need a nursing home. Nobody should ever be in a nursing home. Well, the reality is there are some people who need to be in a nursing home. There are other people who need to be in assisted living or in small group homes or in other kinds of congregate care. Imagine you are an 85-year-old widow with cognitive impairment, no children around. There's no way you can take care of yourself in your own home. There's no way. Even if you have the money to hire aides, what happens when the aide doesn't show up, when the aide's sick? You're going to have to organize a replacement for her. Well, you've got cognitive impairment, you've got some dementia, you can't. You could be a danger to yourself. You could leave the stove on. So there are a lot of people who, because they don't have a family caregiver to take care of them, or because of the nature of their disease, they simply cannot take care of themselves at home alone. So they need some sort of facility-based care. Now the question is, what kind of facility? And there are lots of options. There are nursing homes, there are assisted living facilities, there are continuing care communities where you get independent living and assisted living and sometimes a nursing home. There are these small group homes, which can be terrific. All sorts of options if you can afford them. I was 3 or 4 weeks ago, I was visiting a small group home for people with a fairly advanced dementia. Wonderful place, kind of place where I would like to be if I needed that kind of care. $13,000 a month. Mm-hmm. Talked to the woman who ran it. She's great. So how does it cost $13,000 a month? She walked me through how it costs $13,000 a month. 60% of her costs are labor costs, or the cost of the staff. So if you have the money, there are options out there, but most people just simply cannot afford that. So they need some kind of a facility. Medicaid will only pay for room and board in a nursing home, in a skilled nursing facility. They won't pay for room and board in assisted living. They mostly won't pay for care in assisted living. So what that means is, if you need facility-based care, you pretty much have to go to a nursing home, even though you really don't need skilled nursing care. It's needlessly expensive, and you have to deal with all these hospital-like rules, like you can't get up when you want to and all of that.
Yeah. How do we know when our parents when we should start to convince our parents? Well, for me, it's on the late side for that. How do we know when we should start prepping them for moving into a assisted living facility, even into an independent senior living facility?
Right. So the short answer is sooner than you think, right? What most people do is they wait until a crisis hits. They wait until something happens. Like with my mother-in-law, she had a stroke. What would have happened if she recovered from that stroke? We would have been in an absolute crisis. At some point, the hospital would have said, well, she can't stay here anymore. We'll Medicare is not going to pay for any more time in the hospital. She got to go. Discharge planner says, got to go by noon today. What do we do? Where do we go? No idea. Ideally, in a perfect world, this is what would happen. Before parents are suffering from frailty of old age, parents sit down with their children, with their adult children, and they have a conversation. They have an honest, upfront conversation about what it's going to be like should something happen to me or when something happens to me. Where am I going to live? If I have several kids, which kid am I going to live near or with? How's that going to go? Is Johnny going to be able to take care of me, or is Sue going to take care of me? How are we going to do that? And have those conversations. And don't just have the conversation once. Have it over and over again, because things change. But just keep talking about it. I would say people probably begin having these conversations when their parents are in their 60s, which probably means they're only in their 30s or 40s. Mm-hmm. But denial is the worst enemy of us all. It makes it impossible for us to financially plan for our own care, and it makes it impossible for us to begin to plan for our parents' care so that we're ready when the crisis hits. And we don't want to have that conversation. It's just too hard.
So now the most difficult question of all, I guess, is how do we get over our own deniability and know when it's our time before we get sick, I shouldn't say before we get sick, because in 80s you've got something.
Sure.
How do we know when it's time for us to start thinking about making the move to an independent living, continuing care type facility?
So I think there are a number of things to think about. I mean, it's hard to think about your own frailty. I mean, ideally, we would say, I'm having trouble getting up and down the stairs. It just hurts every time I go upstairs to go to bed every night. I don't want to do this anymore. But that's hard. But there are other ways to think about it. So, for example, think about your friends. Are you still able to visit your friends? Are your friends still able to visit you? And if you're getting to a point where nobody wants to drive at night, for example, that's a point where you start to say, maybe I ought to think about moving into a community. You think about your neighborhood. Often, you think about a very common story. You have a family that raises its kids. You have a couple that raises its kids in a neighborhood. Kids move out. They're empty nesters. They stay in the neighborhood. And they look around one day and they see they're 80 and the neighborhood is turned over. Everybody else in the neighborhood is 35 and they got, 5-year-old kids. And, you don't know them anymore. The idea of having your neighbors over for a drink, those neighbors are gone. And, at that point, maybe you say to yourself, maybe this neighborhood's not for me anymore. You think about the delivery of care. If you live in a suburban cul-de-sac, getting care to you, getting that aide to come to your house is very difficult. She's going to be stuck in traffic for hours or on the bus. So maybe this really isn't the most appropriate place to be. So I think at that point, you sort of think about your environment around you. Same thing with a faith community. You were somebody who, used to go to synagogue every Saturday, or go to church every Sunday, or the mosque every Friday. And now you can't get there like you used to. And maybe then you say to yourself, maybe it's time. I'll tell you a story about my mom. After my dad died, she called and she said, I don't have any more friends. It's time for me to think about moving. One bit of advice for people, I think for the adult children, I think you get in trouble when you start a sentence with, Dad, you got to fill in the blank. You got to move. You got to give up your keys for the car. Nobody wants to hear that. When you're getting older, the main thing you want to do is maintain some level of independence and dignity. And when your kid is saying, Dad, you've got to fill in the blank, you are immediately going to react like, no, you can't tell me what to do. Who are you? So what we did with my mother may work for other people. We said, so after my dad died, before she made this decision, we said, come up here and visit with us. And let's just look at some places. No commitments. We're not saying you've got to move into one of these places or even move to our area. Just come and look at them and tell us what you think. So we looked at 3 or 4 places. And, I said, did you like any of them? And she said, yeah, there was one that I really kind of liked. I said, great. When the time comes, when you're ready, call me and we'll soon get you in. So that's what happened. She called me a year later and she said, I don't have any more friends. I'd like to move. And I called the place and they had a waiting list of a couple of months, but we got her on the waiting list and we moved her in. And it turned out to be a great decision for her and for us. She was 2 miles from our house. So the point is, I think, if you're an adult child listening to this, make your parent part of the conversation and part of the decision making. Don't make the decision for them because it'll never work.
And if you're an individual adult senior, make the decision for yourself when it's appropriate.
Yeah, and the worst phrase, there are 2 terrible phrases I hear all the time in this world. One of them is, I didn't want to worry the kids. That's usually what you say when it's too late, right? The other one is the phrase parenting your parents. Mm-hmm. And the truth is, if you're an adult child, you're never going to parent your parents. You may be taking care of them. You may be doing very personal care for them, maybe bathing them. You may be getting them to the bathroom, but you're never going to be their parent. They're always going to be your parent. And I think it's really important that the parents don't put themselves in a position where they're saying, I didn't want to worry the kids. And the kids aren't in a position where they're sort of taking control of their parents' lives, because both of those are bad situations.
And as an 86-year-old, another phrase comes to mind. Parenting yourself.
Parenting yourself, yeah. So, no, it's you have some responsibility. You think about it as an older adult. It's kind of the last responsibility you have to your own children is to don't put them in this situation where the crisis has happened and now they've got to make these decisions.
Yeah.
It's the last kind of good thing you can do. That's true when you think about things like living wills and advance directives, certainly, because you never want to put your kids in a position where you're comatose in the hospital and they have to make a decision about what's going to happen to you at end of life without any information about what you want. You certainly don't want that. But even short of that, even when it's the kind of situation you're talking about where nobody's dying, but they need more help than they can manage now, you don't want to put them in that situation either. You want to give them the opportunity to know what it is you want, and therefore they can work with you so that you can fulfill that wish.
Is there anything else we should be talking about?
Oh, lots.
No, I mean, in this regard.
Yeah, no, I think in this regard, those are really the things. I mean, it really does boil down to honest communication. Talk about this stuff. Talk about the money. Nobody wants to talk about the money, but you need to talk about that. How much does mom and dad do they really have? And what's a realistic care situation that we can buy into for them? Do the kids have enough resources that they can help their parents or not? And again, have an honest conversation. Johnny may say, look, I'm struggling here. I got, 1 kid in college and 2 more on the way. And I just don't have the money to help you, Mom. And that's fair. I mean, that's the reality of it. But have the conversation. Don't assume. Don't pretend that the money's going to come from somewhere. You're going to hit the lottery. It's probably not going to happen. You've got to make the plans, and the only way to do that is to have that conversation. One of my heroes was I once a few years ago was giving a talk at a synagogue, and after the talk we were having lunch, and a woman came up to me, and she was quite elderly. She was probably in her 90s. And she said, "Let me tell you what I did." I said, "What's that?" She said, "I got 3 sons." And she said, "I called them and I said, we're all having lunch." Okay, we all had lunch. And she said, "I sat down and she said, so this is what we're going to do." And it was everything from who gets the car and who gets the house to this is where I want to live and this is how I want to live and this is how we're going to do this. And I thought, I'm going to take this woman with me every time I give a talk. Because that's what you got to do. You got to, and sometimes the conversation is going to come from, it's going to be instigated by the parent, and sometimes it's going to be instigated by the kids, and sometimes the kids are going to be in worse denial than the parent. They're going to say things like, "Oh, Mom, you're going to live forever." No, Mom's not going to live forever, and the kids got to get over it. They got to understand that. So sometimes the denial is on the parent's part, and sometimes it's on the kid's part, and you got to fight through it.
Howard, this has been invaluable. This guidance for the listeners is just terrific. Really, thank you so much for coming on specifically for seniors.
My pleasure. It's good to talk to you anytime.
Thanks again.
Thank you.
Bye-bye.
If you found this podcast interesting, fun, or helpful, tell your friends and family, and click on the follow or subscribe button. We'll let you know when new episodes are available. You've been listening to Specifically for Seniors. We'll talk more next time. Stay connected.